So the aims of the Test and Learn programme are to increase the amount of evidence we have within the UK and within the homelessness sector of what works to end rough sleeping and homelessness. So where we're at right now with our Test and Learn programme, we're just wrapping up our first evaluation, which was the Care Leavers programme funded by the Ministry for Housing, Local Government Communities and the Department for Education. We're just in our final weeks of the Using Data project, where we identified folks at risk of homelessness, and we're calling them in 4 areas in England. The Accommodate and Connect project and the Accommodation Immigration project, the first areas that started were in December and January, so they're just getting ready to end their intervention periods. For Citadel, we have personalised budgets and individual placement and support. We have recruited all the people that are going to be part of the projects, and now they're all in their delivery phase, so making sure that people are getting supported, and again, we're tracking the outcomes over time there. For Outreach and Health, where we have nurses in 8 areas of England, and we're comparing them to the control sites which don't have a nurse. We are continuing with delivery all the way to May next year, but our baseline period, so our initial surveys, are due to end at the end of October. So in terms of Test and Learn and the number of people that are part of the programme, there are now over 3,400 people that are taking part in our 8 trials. Some of those are receiving intervention, some of those are receiving vouchers for completing surveys, and we're excited to hit this milestone. So far with the Test and Learn programme, I think in terms of those favourite moments, it's always hearing about the direct impact that these services are having with people at risk of or experiencing rough sleeping and homelessness. So, there are things like one of the outreach nurses telling us about how they managed to get someone the support through the Mental Health Act, finally, that they probably needed for quite a long time, but that difference in that case being that it was a nurse phoning the A&E department rather than one of the outreach rough sleeping teams. So yeah, another one of my favourite moments was actually on our Using Data project. Like, this is something that a lot of us who have previously worked in local government have really struggled with for years. It's about how we bring together all our data systems and use that to benefit the people we're trying to support. So getting that project up and running from May 2025, where we started making phone calls to people that the algorithm had identified at risk of homelessness, was really fantastic. So in terms of what I'm looking forward to next on the Test and Learn project, I think we've got a real opportunity to share some of our implementation learnings so far for these projects. So if you're thinking about having a Using Data project in the future, we have lots of learning from the 4 local areas that I've been working with, as well as our evaluator and their implementation partner, Xantura, about how you can do this in your local area. And that's the same actually with all of our interventions, is that we are gathering lots of insights now to help you, if you are considering doing these projects, think about what makes them work and what makes them unique.